So that's the story. Kerala reels under Nipah and Monkey Pox. Kerala is once again grappling with the threat of Nipah. This is the second Nipah outbreak in the state this year and the sixth since the virus was first detected in the state in 2018. Kozhikode in particular witnessed Nipah outbreaks in 2018, 2021, and yet again in 2023. Malappuram too reported Nipah cases in 2018 and yet again in July and September of this very year. Ernakulam too has reported Nipah cases in the past. But you know what stood out in Ernakulam is that it happened to be the only district in which the primary case did not result in the death of the patient, which is actually good news. But why? Scientists must be wondering. In all other outbreaks in other places, the primary cases resulted in the eventual death of the patient. Now, the government has issued repeated directives in September last year to conduct extensive surveillance in Kozhikode, which is one of the epicenters of the outbreak, but not much headway has been made. While the health department's efforts to contain Nipah were initially seen as a success, the World Health Organization pointed out that there were lapses in collecting timely and accurate data to better understand the epidemiology and the clinical and virological characteristics of Nipah. You know what? Another question which yet remains unanswered is that why is the Nipah outbreak localized to Kerala? I'm not sitting on judgment here. I'm just trying to figure out why. While it is agreed that fruit bats of a specific variety are perhaps responsible for spread of the virus, the reason behind the human transmission also remains unclear. There is, a missing link between the animal and the human transmission of the virus. And this is perhaps the reason why creating preventive strategies against Nipah has been a challenge for health authorities. Now, health experts also say that environmental factors play a very important role in the spread of the virus. In order to understand the disease's root cause, a deeper examination of the wildlife and their habitats is required. And guess what? Nipah is not only the cause of concern for health authorities in Kerala. A suspected case of monkey pox has also been reported in Malappuram. The suspected patients had recently returned from Dubai and started manifesting symptoms. The question is, what makes Kerala vulnerable to these virus outbreaks? That is first question, without sitting on judgment, of course. And what is the missing link between animal to human transmission? Let me now welcome all the guests, the experts on the panel, doctors, Dr. Ajit Bhaskar, Professor of Pulmonology and State Secretary PEPS IMA in Kerala, and Dr. V. Ramankutti, Public Health Expert from Kerala. A very, very warm welcome to both of you. Dr. Bhaskar, I want to come to you first, and without really sitting on judgment, let's take the case of Nipah, Doctor. Kerala has been able to contain it. They are very, very quick insofar as detecting, the symptoms are concerned, the cases are concerned. Like, for instance, in Malappuram now, they told all the contacts of this patient who passed away, who had come from Bengaluru, the 24-year-old, to kind of mask up everything. But there is one thing I want to ask you, because, I know that it is very silly, but the next time we hear about COVID and we hear about, China, our ears will perk up and say, oh, not again. So is there something, I've been talking to a lot of people, they say, look, Kerala, the boundaries between the forests and the human habitats is very less. Is that one of the reasons that we see such frequent outbreaks, Dr. Bhaskar?
Well, I don't think that you need a forest to have an outbreak of Nipah. Probably a bat that is infested with Nipah virus or a pig could start off be such an endemic. So the first time when it occurred way back in sometime in 2017, it occurred in the tiny hamlet of Perambur. There, that incident, I don't know whether you remember, 2 persons who came from Malappuram at that time to a hospital where one of the Nipah patients was admitted. They traveled through the CT scanning room, and probably these 2 people got affected. They had nothing to do with bat infestation at that time. So that was the severity of infection in 2017, where we lost about 17 to 18 people. Only one person survive. We also lost so many. Now, here, last year also, I mean, about 1 month back also, we had an outbreak of Nipah in Malappuram again. So probably one of the reasons is that maybe there is an endemic area in Malappuram and some of the bats were tested positive for Nipah virus. And Sperambra, Nadapuram, those were the areas where the biologists came down and they checked up and they were able to identify 1 or 2 isolates of the virus in bats also. So how it came, probably these bats must be harboring the virus, and sometimes it gets it gets into its more than an outbreaks of it. But
All right.
I don't think there is anything to be alarmed about, because this is basically an endemic disease and spreads only from bats to humans.
Yeah.
And maybe or an infected human. And it doesn't spread by air. It's not an airborne.
Of course. I mean, fruit bats are supposed to be the carriers of it. But the question is, Dr. V. Ramankutti, if I can have you on the screen, Dr. Ramankutti, is that bats to human beings. Now, every time there's been an outbreak, and I have discussed it on the South Indian, the show, because it is just to, not to alarm people, sir, but just to inform people, as it's always been our endeavor. Bats to human beings. The thing is that, look at it. I mean, doctors have told me, suppose a bat bites into a fruit, just a hypothetical, and my child happens to be walking under that tree, picks up that fruit and eats it. I know it may sound preposterous, but we've spoken about how the spread can happen. After all, scientists only trace it back like that. Then the child can get infected. But in this case, this man came from Bengaluru. This 24-year-old, I'm not saying that he was not in contact with someone who may have had Nipah virus in Bengaluru. Of course, he unfortunately lost his life in Kerala. But what I'm trying to say, Dr. Ramankutti, is that this animal to human transmission, how well has this been researched? Do you think that is the root cause finally?
Well, that seems to be the consensus. We actually are not very sure. I mean, these are still being investigated, but it's almost everybody it seems to agree that there is an element of animal to human transmission, and this has happened in areas like Malaysia, then I think Bangladesh. Everywhere this outbreak has happened, they have traced it to bats, and basically bats. So. And they really don't know why, because these viruses do not seem to be causing any problem to the bats. So what happens when it gets into the human is it probably gets mutated and becomes just like in the COVID case, something which is residing very peacefully in the animal. When it crosses the species barrier, becomes pathogen. And interestingly, this has been only reported from very localized areas, and that is something which is very intriguing. And they have suggested that this is something to do with areas where there is animal-man conflict, in the sense, when their habitat is kind of encroached upon, or they become agitated. There is a theory that it actually secretes more viruses when the bats are stressed. So all these things are still conjecture. We don't know, but the only thing we know is that it happens in individuals, local places, and one of them is Kerala, especially in the north of Kerala, Kozhikode and Malappuram. So we really have to study what is happening.
Right. So that's what, exactly, Dr. Ramankutti. Dr. Bhaskar, this is what I began with, that it's intriguing. However, those are the reasons. The man-animal transmission, which seems to be a mystery, that's not been yet solved. And for people who live outside Kerala, certain names keep coming up. Malappuram, Ernakulam, Kozhikode, these names keep coming up. I mean, according to Dr. Ramankutti, he says it's being, of course, we still have no answers to this, but there seems to be a connection. Is it because of, the stress that the bats feel, etc., etc.? But Dr. Ajit Bhaskar, despite the point that the government, and Veena George has again said that we are containing it, there are containment zones, why is it that there is not enough information which is coming out? to say that if these areas are vulnerable, then we better do something about it. After all, some species are more vulnerable to certain diseases than the rest. You know that as a doctor.
Well, that is not absolutely the truth, because see, last month we lost one boy at the age of 14 years. That was just last, probably somewhere in July. Young boy, 14 years. And we don't know whether July, sometimes you have these summer holidays and they go out and play in the fields, maybe climb up the trees, and they explore, and they might have eaten a fruit which has been bitten or embedded with saliva or the urine of bats. Now, let me also tell you that not all the Nipah viruses are infected. There are non-infectious Nipah virus is also being picked up. So
Right.
probably maybe some mutation or some of the infective varieties, the unfortunate patient would have had, but you can't say it is an outbreak. Hardly one patient has been affected, and all the other 16 to 20 contacts have been tested negative.
No, but yes, Dr.
Now,
Bas, I'm happy that
Yes.
they have been, but look at the work that you have to do. You have to trace back all the contacts. If I've come from abroad, let's say I've come from Dubai, then all those contacts have to be traced. There is a lot of work, and it creates unnecessary panic. After all, Dr. Bhaskar, when there was report that some people were dying of brain amoeba or in some such thing in Kerala, it was seen to it that because they were swimming in the pond and because of that through the nostrils, I mean, I just feel to contain Nipah is fantastic. Like I say, the way Kerala controlled COVID made it to world headlines, sir, under Shailaja madam. But I'm saying that why is it that despite 4 or 5 outbreaks, there is no kind of, a chart. Like you gave us a chart during COVID. You gave us a chart during this pond and said, do not swim unnecessarily into these ponds. Tell your children not to go there. There is no specific SOP for this, is what my question is,
Yes.
Dr. Bhaskar.
No, there are specific SOPs. We
Okay.
clean, and when you eat food or when you're handling animals like pigs or this thing, make sure that you wear a mask and you don't physically get into contact with the secretions or droppings of the pigs or pigs, especially when you are having a Nipah outbreak. Now, COVID is different because that was an airborne disease and it was an epidemic. So let's be very clear about this. This is an endemic where only few people affected. Even the first episode when it occurred way back in 1998, if I remember correctly, there were about 285 cases and about 40% of them died. That's about 105 to 106, if I remember correctly.
Right.
So that was the first episode. So yeah, even in that outbreak, when they were not diagnosed initially because they thought it was Japanese encephalitis. Now what happened was, even those people who were vaccinated against Japanese encephalitis, they also developed this disease and succumbed. And that was the time when these doctors thought in the initial episode of 1998 somewhere, they thought that it was something fishy because even people who were vaccinated for encephalitis, they also got the disease. That was the time when they picked up, and later PCR and all those things came up, and they picked up Nipah virus.
Right.
But virus has been there even earlier as in 1960.
All right. Yeah,
But
sure.
but the infective variety comes up only sporadically. Yeah. And one more thing. Now, it is probably every person is
Okay.
genetically different. So you have your 23 pairs of chromosomes. The chromosome mapping is entirely different, and one person might be a little more susceptible than the others. So that
Sure.
is the
Like I
something
said,
called as the genetic
yeah,
mapping.
sure. Genetic makeup, it does matter. But, my question is once again, if you look at it from the layman's perspective, Dr. Ramankutti, I want you to answer 2 questions for me, please, sir. One is monkeypox, where this man returned from Dubai, and now the first case of monkeypox in Kerala has been. Is it dangerous, Dr. Ramankutti? Do you think this will also be, fall into the cyclical thing of whether it's an endemic or whether it is an epidemic or a disease or airborne or waterborne or touchborne, whatever? Do you think it's dangerous at all? Should one worry? Should people with comorbidities worry?
It could certainly be dangerous. But the interesting thing about monkeypox is that it's not like Nipah. It is a different, because it seems to be changing very fast.
Right.
We have traced that the kind of monkeypox which appeared some time back in Africa and So that is a complete, it was actually limited to men having sex with men and certain groups. But this new strain seems to be have no such limitations.
All right.
It is so it's a different, but it basically the virus is the same, but it has mutations. So it's a different kind of monkeypox, and they have the actually the World Health Organization's calculation is that it can be contained by vaccination, but unfortunately we don't have enough vaccines to kind of cover the whole population in
Right.
Africa, let alone other parts of the
Yeah.
world. So that
Okay.
is how it
Yeah.
more dangerous.
Also, doctor, I wanted to, here quote the World Health Organization. They said that not enough research has been done, clinical trials to understand, the transmission level of Nipah between animal habitats and human habitats. Would you agree that we still are at
Absolutely.
a very nascent stage, Raman Kuti sir, although we are having cases and, like Dr. Bhaskar said, we had a teenager lose his life, some time ago. So the thing is that again and again you see Nipah, of course, I keep reiterating this. I should not be seen as someone who's cherry picking on Kerala. We see that it's being contained, the health minister comes enough. But then the point is, isn't it time now after 5 outbreaks to see, I mean, I just don't understand that, eating a fruit or, which is bitten by a bat. How do I know there are 10 bats sitting on this people tree under which I'm, actually going for because I've also spoken to other doctors who said some of them were just passing from under the tree and it could have happened, So the thing is, do you agree that we need more solid research, sir?
Absolutely. I would agree 100% with you.
Hmm.
See, the things that so-called experts say now, the same things that they said during the first outbreak.
Hmm.
They have not added one bit of information because they don't know anything more. And that is because nobody has done any research. And I think we are waiting for somebody else to do the research, which will not happen because Nipah is not a priority if you take internationally. It is, number of people affected, number of deaths happening, so few. But it is a priority for people in Kerala because it's happening here, right here. So it is our responsibility that we should initiate research. Unfortunately, that is not happening, in spite of the fact that the government of Kerala seems to be saying that our policy thrust in public health is going to be One Health. The concept of One Health is that animal health, human health, everything should be considered. I mean, they should not be in separate compartments. We should consider health as one thing and then do research on that. That concept is called One Health. And we reiterate everywhere that we are going the way of One Health, we are doing One Health. But I don't know what One Health they are doing because if they can't, I mean, this seems to be an ideal problem for One Health. So
right. Yes, I hear you. I hear you, doctor. Dr. Bhaskar, tell me something. Should I be worried because you're a doctor? I'm sure you wear a mask all the time because I remember during, I've interviewed you many times. Today, the first time I'm seeing your face actually, Dr. Bhaskar. Good to see you, without the mask. But the point is that I'm sitting, I'm teaching, let us say in Ernakulam or Malappuram in a school or a professor, in a college. How do I safeguard myself from the Nipah virus? I know it's not airborne. How does one protect oneself and others when the symptoms are very similar? Apparently, correct me if I'm wrong, you have some, cold and, very viral fever kind of symptoms. But don't you think that instead of letting oneself be vulnerable, if I'm teaching in Malappuram, Ernakulam, Kozhikode, how does one solve this?
Well, cleanliness is next to godliness. If you are clean,
Right.
it is very unlikely that you are going to. And if you follow the Bharatiya Samskar, like saying namaste rather than shaking hands, because you do not know your closest friend giving you a shake hand might be infected with Nipah virus. How will you know? So during these infective episodes, even without infective episode, it is always better to keep a safe distance. Wash your hands after touching anyone giving shake hands or touching anybody. For example, for all of us, after touching a patient, we sanitize our hands. And of course, since I'm a doctor, whenever we see a patient, they come with all sorts of respiratory infections, but we always wear a mask. So this time it's not loaded. I have kept this section 1 hour free for this. That's why I'm not wearing a mask right now. So Nipah, you be clean use soap and water to wash your hands frequently, avoid handshakes, and avoiding eating foods which are not washed. Even if somebody offers you a food which is not cut, make sure that you wash it properly, nicely with water and soap. Clean it before and take off the skin of the food because it is where it could have been contaminated. So these are the main things. So I don't think you should be worried if you're a teacher in Malappuram, Ernakulam, or Kozhikode. Nothing is going to happen to you unless you are careless and we have unclean habits like not, washing our hands properly and not wearing a mask when you're going to a hospital or a crowded place. And again, let me make it very clear that Nipah is not transmitted through, aerosols. It is by close contact and droplets, by close contact from either animal to human or human to human, an infected human. That is the only way you can get it. So
All
whenever
right.
you are going to some
Okay.
place or pray, keep yourself clean. That's all. I don't think you should be much worried about this.
All right. And
Wherever
on
you are,
that
keep
note,
yourself clean.
yeah, and on that note, I've completely run out of time. Dr. Ajit Bhaskar, thank you very much for joining us.